Started Ahalia from zero today, 2000 a day. So what are the ethical ways you can suggest?
Hospital gets patients only because of the quality care. And there are no compromises in that.
What are the key challenges managing hospitals today?
The core manpower in any hospital is medical and nursing.
And what makes you turn into administrator?
Coimbatore is Ganga Hospital. Ganga Hospital was basically a single specialty hospital. Now your question is that how do we run this successfully?
Why I have asked now, sir? Since you said the one big eyes required is finance. Finance required is coming from patient flow. So the patient flow building is very important to get the correct finance. So that is why I was asking this.
You have been in healthcare because you have been meeting doctors, you have been seeing how patients go to a doctor, etc., etc. If you have seen any doctor who becomes popular as well as good in his practice purely because of two things. One is the quality of practice which he has and the results which he gives. These are the two things which makes a doctor popular amongst patients. Having said that, once in the Indian scenario, because we never say no to a patient. Many other countries outside in the world, that people, you cannot, they will have very clear-cut defined practice by appointment. Whereas in Indian scenario, many of our doctors, they see, sometimes a general practitioner see about 100 to 150 patients, sometimes even more than that. Even specialty doctors. In fact, as a cardiologist, I have seen around 75 to 80 patients a day in peak practices.
You are very renowned at that
Yes.
point.
So in that way, so what brings patient to the doctor is primarily because of the quality care and the results what he does. Once you build up that practice, then you have an option to continue practicing like that, or why can't we have our own setup?
Yes.
That is where that. Now, many doctors, they decide to have their own setup for two reasons. One, they make it as a family practice. For example, a doctor marrying a doctor whose brother is a doctor, whose brother's wife is a doctor. So like that, they form a core team who can do it. There are so many models like that.
Yes, sir.
Like here you take our Abrahami hospitals or Gem hospitals or Tangam hospitals in Namakkal, like many hospitals we have. Number two is, as this thing, you develop the same specialty related. For example, if you are a cardiologist who is starting a hospital, then you pull in cardiac surgery, you pull in pediatric cardiology, you pull in some sort of all the related cardiological sciences together to make it as a single specialty hospital. This is how exactly they want to do expert care in that area as number one. So you have a good autonomy to practice and you have a complete independence to practice, because these doctors have proven their worth in some other hospital, so they feel that why can't we have our own. The second important thing is definitely finance, because as a medical doctor, if you are able to, with your expertise, if you are able to earn a decent money, when you start a hospital, that decent become more decent. What I mean to say is, there are instances where a doctor who was earning probably around 3 lakhs or 4 lakhs a month with his practice, once he becomes a owner of a hospital, once he becomes a successful owner of the hospital, the earning is endless.
Yes.
So, passion, independence, autonomy, family practice support, plus finance. So these are all the things which makes people to get into the idea of starting hospital.
One more point I get an extra is that if you want to be successful, you should have allied partnership. You should have a good partnership, so that will bring more patient flow also. So, in today's scenario, you need to be profitable in a hospital because so many things to be taken care, not few parameters. I heard that some 45 parameters to be fulfilled for an legal side itself.
Yes.
Like starting from ESAPF, like that. So how to ensuring the quality care? How at the same time you maintain your profitability? How PSG does?
See, as again, they are all models. Once you have ventured into start the hospital, once you have decided or once you have started a hospital setup, you have to clearly understand a hospital has two wheels. Hospital as a vehicle has two wheels. One wheel is the general administration. The other wheel is the medical administration. When I say the general administration, that is exactly the one which is the key component of hospital, which will have all the supportive departments to run a hospital. For example, it starts from the infrastructure of the maintenance team, the HR team, the biomedical team, the dietary team, the security team, the general administration team, so housekeeping. So all these are all the basic ones which are, I named them as general administration. Other important wheel is the medical administration. Now medical administration team has doctors, the nurses, the technicians, and all the people who support the OP and IP practices, like the front desk people. So these are all the people which run the medical administration of the healthcare services. Both these wheels are the most important for any hospital. So in PSG, what we have been doing is we have created an exclusive team for the medical administration.
Okay.
In fact, which I head, wherein we have almost now currently we have around 210 doctors practicing.
Wow.
And around 1,200 nurses in the hospital.
Very high number.
And with a large supportive team to the tune of, now currently we have around 4,300 employees in the hospital, which now currently has an OPD intake of around 1,800 a day, if you take medical college and the
Super
specialty. So I have an operation team which exclusively take care of them, and I have been very clear with my team. The two important things in our medical administration is quality health care and the patient experience. These are the two important things which is concentrated in this medical administration. Our doctors are extremely committed, very, very knowledgeable, very experienced. In fact, I smile and say that I need not tell my doctors what to do. My job is very easy. I always say I am a leader who lead from behind. I don't lead in the front.
Yes.
I am at their back. I support them for them to execute what they want.
Yes.
Come to me only when they have some issue. Otherwise, they don't come to me. The second important thing is I have created a very strong team in the medical operations, where I have made it clear the customer, the so-called customer to the hospital, is a patient. So patient first. And I call it as patient, not patient experience, patient delight. So a patient who comes to the hospital is the boss. So you have to make sure that he is taken care well. This is exactly is what is strived in the medical side. The general administration, as I told you, when I said two important departments which I forgot or which I did not tell, were the insurance and billing, which is again very, very important.
That is very important.
Which many a times, the patients are extremely happy with the doctors, nursing, but they get really upset with these services. So this happens in many hospitals. So having said, the general administration currently is being taken care by one of my colleagues. So we both take decisions together.
Yes.
So this is the model which we run in PSG Hospital. So we have been very, very successful in doing it primarily because of obviously the long-standing commitment. Like as I told you, I came to PSG as almost a 30-year-old cardiologist, and I am just 60 now. So 30 years of experience, which was a short stint of 5 years outside Abu Dhabi, I came back to PSG. So, and very interesting thing which I may probably have to tell you is PSG's finance model is very, very different compared to many others. We are zero borrowers. So we work with our capital expenses. Our investments are totally from our capital, and we don't borrow. So in that way, our finance model is much, much different than many other finance models which the city or the world has. So having said, the general administration, they do their best to support us. The medical administration, we take the ball forward. And our current model has now made us one of the best hospitals in Coimbatore, probably even in Tamil Nadu.
So the secret is that not getting borrowed outside.
No, that is not. I don't think it is. This is possible with many others. Even I remember many of the people have approached us and said that why you want to spend your capital money? Why can't you borrow? And then it's something like there are people who do this. There are models in which people, in spite of them having money, it's like many times we do this for car buying. So you may be able to afford to buy a car by paying 20 lakhs or 25 lakhs. You may definitely be. But still what people do, you probably put on 10 lakhs, you give 15 lakhs, you go for loan. The reason what you say, one is it may have some financial benefits in your taxation. And number two is that there are people who feel that having a loan makes me work better. So there are people who have a different model. So having said that, total capital expenses of this magnitude is I don't think it's a very unique model, I would say.
Thanks for the answer, sir. So can you share some of the ideas on how to manage budget effectively for the new hospital owners?
Our experience, what we do is, we have, although we are a trust hospital, once I have taken over as the director of the super specialty hospital and PSG, we have been running it properly like a corporate hospital.
Okay.
By which what I mean, we have every month we have the performance assessment.
Okay.
Every 3 months we have a finance review. And every 1 year we have budgetary review meetings. Now this is our model. Most important, I would say that any hospital owner, whether your money or borrowed money, you should be very clear in having a very good financial manager or a financial supporter. Because if your knowledge may be there, but that may not be sufficient or adequate. So you should have a good financial, reliable financial advisor for you to run the show. And the most important is, if you have to do a budget allocation, you have to take it into mind a couple of things. Number one is a hospital, if you have to run it profitably, current availability profit margins for any hospital in total is probably about 20% too. And if that has to happen, you may have to plan your budgetary allocations, which should be providing adequate scope for the future expansions. Okay. Like how, the depreciation is very commonly, everybody understands depreciation. When you say that you have a depreciation of 25%, in healthcare we take 25%, not 20%. 25% a year. If I buy an equipment and I have a depreciation of 25% a year, same 25% I should be able to allocate to my budget.
So for future expansions.
Yes. So if I have to expand in the forward way, if I have given a budgetary allocation of 100 crores, so my next year budget allocation should be 125 crores. So this is one way of looking at budget. The most important thing is, any successful model will only happen when you plug the loops of money loss. Now, in a medical setup, it can happen very rampantly in the purchase areas, in the billing areas, and the pilferages are very, very well known in many places. So, a very good model of the managing the finance is to control the what do you call this, the loss. So that means our budgetary allocations, we have very clear ideas. What should be our capital expenses for expansion? What should be the money which should be there for the day, the regular running of the hospital? And what should be the money which is there for the expansion of the future? Infrastructure expansion as well as the technological expansions. So like that only we plan. And I told you, keeping this 25% in mind will be of very good use.
Lovely, sir. The summary is that you should have a best financial advisor in your team. And second, you should have a meeting rhythm, like monthly, quarterly, yearly review should be there. And the proper allocation of funds should be there for depreciation and expansion, that should be there. Sir, next question, what should be the pricing strategy?
I will tell you our model. We have a very clear-cut defined pricing policy. Now what I do, for example, now we have started our oncology. So for oncology, I have two references. Number one, I have a casting team. So we have a team which is a full-fledged casting team. So I tell them to do costing for a procedure.
Okay.
So they do a proper costing, investment, interest, manpower, the consumable, everything they calculate, and with probably the professional fees added, they do a costing. Then they, example, I'll give you an example. Okay, PET scan you take, a regular PET scan. A regular PET scan, we do a costing, we come up to a particular value. Okay, for example, 7,000 rupees is our costing per case. If we do probably around 12 to 15 cases a day. Whereas the PET scan is being offered in Coimbatore itself in about half a dozen hospitals.
Yes.
They have a tariff, existing tariff. For example, the existing tariff on an average is 15,000 rupees. Our costing, we have got 7,000 rupees per. I have my neighboring hospital, a reputed hospital, offering it for 15,000 rupees.
Okay.
Now, I have a choice. Where do I fix? What generally we look at it, we want to be a cost-effective hospital. At the same time, we are ready to cut down on our profit margin to make sure that many patients should be able to afford PSG's tariff. So we fix 12,000 rupees or 10,000 rupees. So that means I should always have a costing. So I should know what is my expense in every individual procedure or a surgery or a cost, whatever it is. And I should know what is the prevailing on an average outside. And so I fix in between lower than my competitive hospitals. At the same time, it should be still positive for us. This is a strategy which we should always adopt for you to be successful.
Lovely.
And so this has been our model. And we have now, even for a small procedure, any simple thing, we do a costing. So of late, I would advise all the hospitals to have this strategy of costing. Never go by just only by, okay, somebody is charging 7,000, let me charge 6,000. That should not be. You should know what is going your cost. And so you should be very, very cautious. And this is what you call it, this is a hygiene of
Professional way.
Tariff fixation should have a hygiene. You know that historically, PSG was started as a medical college. PSG has already completed 22 heart transplants the last 2 years.
What are the new things changed after COVID?
Hospitals should be able to spend money on these things.